My name is Byron Wood. I'm a member of the Workers for Ethical Substance Use Policy. Our group is made up of workers who have been harmed by government drug policy and workplace drug policy. We provide support to each other and we fight for policy change. Our group is continually growing. Our members include people who work in construction, the trades, teachers, paramedics, firefighters, doctors, nurses, lawyers, government workers, secretaries, counselors, food service workers, cleaning staff, healthcare technicians, dock workers, transport and transport workers, truck drivers, warehouse workers, and peer support workers. Last August, one of our members, a registered nurse, was killed by the unregulated toxic drug supply, was killed by the government's prohibition drug laws that created and maintain the toxic drug supply. According to data collected by the BC Coroner, almost half of the people who have been killed by the toxic drug supply were employed at the time of their death. Many others were pushed out of the workforce by discriminatory and harmful workplace substance use policies. The people who are dying from the toxic drug supply, dying as a result of government drug policy, dying from preventable deaths, are the people who build and maintain the infrastructure for society, provide children with education, provide health care, provide the services that society needs in order to function. Unions are recognizing that bad government drug policy is harming their members. Bad government drug policy is killing union members, killing our co-workers, killing our family members, killing our friends and our community members. The government's prohibition drug laws have resulted in a 7-year-long public health emergency, killing over 13,000 people in BC. This is unacceptable. Ending the war on drugs and ensuring there's a regulated drug supply is a working class issue. For more than 100 years, the labor movement in Canada has been a driving force for social and economic change in workplace safety, healthcare, childcare, environmental protection. Now we must take up the fight to end the longest public health emergency in BC history. We must take up the fight to ensure that the drug supply is regulated. The labor movement has already begun this fight. The BC Federation of Labour, who represent 500,000 workers from every part of the BC economy, through over 50 affiliated unions, have declared their support for regulating the drug supply. The Canadian Union of Public Employees, who represent over 100,000 members in BC, have declared their support for regulating the drug supply. The Vancouver and District Labour Council, who represent over 60,000 workers, have declared their support for regulating the drug supply. The BC Nurses Union, who represent more than 48,000 professional nurses and allied healthcare professionals, have declared their support for regulating the drug supply. Union power can propel massive shifts in public policy. We're calling on workers and labor organizers to take up the fight to stop the preventable deaths of our union members, our co-workers, our family members, our friends, our community members. The labor movement must fight to end the war on drugs, to overturn the government's prohibition drug laws that are killing us, and to ensure there's a regulated drug supply. This is a public health emergency. This is a working class issue. Drug user activist groups have been fighting this battle for decades. Now the labor movement is joining the fight.